Hello friends, today we're going to go over a medical bag. This is part 2 of the emergency bag that I did in the first video, so now we're just going to go over a medical bag. We're going to go over what's in the bag, not necessarily every single detail and why you would need that, the things that are in there, but just a quick kind of a brief overview and just what's in my bag, and you as a listener can decide if you want to put anything else in your bag, or maybe you wouldn't want to have quite as much. Maybe you want just some stuff in there just for yourself, or maybe you want this, you want to be a medic and, you have a lot of certifications and you're able to really deep dive down in and have a lot more intricate or more detailed items that would, serve a bigger purpose than what I got. So let's get into it. So the first thing about this med kit is that you can kind of see how quickly I was able to open my bag and to be able to have everything out in the front like this. Everything's out here, it's out in the open. You don't have to really look for anything. Everything's right in your face. I don't have things hidden behind zipper and bag and hidden underneath stuff. It's kind of really right out open in your face, and that's kind of how you want it. When someone's in need of help, some type of an assistance, they're injured and time is of the essence, you need to be able to just open your bag and go to it. Also, if you're unconscious and you're injured, someone needs to open up your bag and be able to look in there and be like, it's right there, I can see it. They don't have a hard time looking through your bag to help you because you're not conscious to be able to help guide them through. Or maybe you're just in too much pain and it's going to be really hard to be like, yeah, it's in that third pocket down there in that little bag down there. And, realistically, that's probably not going to happen, right? So right off the bat, I got gloves here, right out in the open. I got more than one pair of gloves. Reason being is that someone else might, need a pair of gloves. Two of you, right? You got an injured teammate or you come across someone that's badly injured. It takes two of you to be able to help him, not just one. So it's good that both of you to be able to glove up and take care of him or her. I also have large gauze pads. Always could use some gauze pads to be able to soak up some of that blood in that wound and get it going. We've got some more pads here. This is 4.5 inches by 4 yards long of some wrap. And I'm sorry if I don't use the right terminology. I don't have a medical degree or I'm an expert. This is hydrogen peroxide. Just a little bit of a spray on there. I have that in my bag out in the open. This is alcoholic prep pads that I have here. And antiseptic wipes. Got those in here as well. Have a couple wraps here to be able to wrap up the wound or after everything's wrapped up and taken care of. And we have some tape. Along with out in the open, we have our scissors just in case if we have to cut someone's shirt, pant leg, or the shoelaces to be able to take his boot off or what have you, whatever type of garment he may have that requires for us to be able to have to remove that, right? Up front, in this little package here, I got a tourniquet, which is very important to have. We can go over how to apply a tourniquet in another video. I'll be able to show you how to put that on properly. Here we also have an emergency compression bandage. Got one of those as well in there. Some other bandages, a triangular bandage. Maybe you can pause the video and kind of see, get you a little bit what that is. Some more extra tape just in case if we have any issues. I run out of tape for any reason. Got an emergency thermal blanket. Got a lot more alcoholics wipes. I probably said that, butchered that. Alcoholic prep pad. I have a lot more of these in here as spares just in case. I always keep a little bit up front, just so I don't have to go to this back and forth to this second pocket. If I have a severe wound, then I'm able to have everything right up here up front, or the person that opens it up is able to see all that stuff, and they'll be able to help me if I'm injured or not conscious. This is a compressed gauze. It's 4.5 inches by 4.1 yards. It's all compressed in a hard package there. Safety pins. Never know when you might need some safety pins to be able to safety pin something up. Markers, just in case if you need to write, you know, when the wound was wrapped or when the tourniquet was placed, how long. Then we got some other bandages here. We got a dressing, some dressing here, adhesive wound dressings, sterile gauze swabs, a couple of them. And then last but not least here, this is kind of like I said, like a boo-boo kit for small minor aches and pains and scrapes and things. You know, it's always good to have. Bandages, a lot of different size band-aids, not just small ones, but big and large ones. What these are here are blister patches for your feet. Some people have really bad feet, and it's good to be able to have blisters taken care of. You know, if you're hiking, you know, for many miles, or, you know, whatever the terrain is, you know, you get sand in your boot or water in your boot because you don't have waterproof shoes, and you're starting to hike, man, and you end up getting blisters on your feet, or you have some type of cracked heel, you know, because you get dry heels and it cracks. You need to be able to take care of your feet, because if your feet get damaged and you're out there hiking, it's going to be really, when you thought your troubles were already bad enough, this is really going to be bad when your feet start blistering up and you start getting your feet not taken care of. And then here is just some small things. Move this out of the way. Chapstick is obviously, that's what that is. Chapped lips suck, especially, you know, everybody's had chapped lips, and if you don't have chapstick, they just get worse. And you know, it's a aggravating thing to have. Chapstick literally weighs nothing. It's extremely light. It didn't bother me in my kit, my weight, you know, at all. It weighs nothing. It's good to have. Antibiotic cream, or, you know, if you get a cut or something, you can put that on there. It's not made for like a severe gash or some gaping wound, but if you have, you know, a pretty good, you know, scratch or whatever on your hand or your arm or whatever, you don't want it to get infected, you can throw some of that on there. Or if some of you have kids with you, and you know how kids can, you know, can get scratches on them, and you know, you can put that on there to kind of help ease their way. This is Tylenol. And so is this. This is Tylenol as well. I keep these for, you know, any type of sprain, pain, headache, I don't know, you know, you name it, some type of pain. This is ibuprofen. And I have 10 tablets. And I mark them as well so we know. 10 tablets in each bag. Same goes for the Tylenol. Same goes for the ibuprofen there. And I always keep 2. There's 10 more there. I don't have to carry the bottle. I have them in little baggies like this. It's lightweight. It takes up hardly any room. I got 20 pills of ibuprofen, 20 pills of Tylenol, and then I got 20 of these as well for these dual pain. Now these dual pains are the ibuprofen and Tylenol together. Okay. So if you ever run out of these, then you can actually take the ibuprofen and the Tylenol to make one of these as well. But I keep these separate. Benadryl. Any type of an allergic reaction that you might have, or allergies, any type of issue, rash you might have coming up, flaring up, or whatever, hives, and you can take you some Benadryl to kind of help ease that way. And the last thing I got here is a pair of toenail clippers and tweezers. Okay, super important, I believe, to have these, especially tweezers. A lot of people have ingrown toenails. They have issues, right? And what a bad time to be able to have a bad ingrown toenail of some sort, or some type of toenail issue or fingernail issue. You know, you might be hiking or whatever. You know, whatever the case may be. You know, you might have a nail that ripped off on your thumb and you need to pull the rest of it out, or something. You know, you tripped and fell and had a nasty splinter piece of wood go into your hand of some sort, and you need a pair of tweezers to get it out, or you need a pair of tweezers to kind of help get that ingrown toenail out of your foot to kind of relieve some pain and, you know, suffering off of you. Whatever the case may be, a pair of these, you know, tweezers would come in handy. You know, you got to take care of your feet. If you don't take care of your feet, you're not going to be able to go anywhere. It's imperative that you take care of yourself. So these items here, the Tylenol, the pills, the chapstick, the antibiotic cream here, and all this stuff literally weighs nothing. It's a little boo-boo kit. Just, you know, it's not made for big things, but it could keep the small injuries down so they don't become a big problem later. Another thing about this bag, what would have been probably a good idea, is to have a couple chest seals in here, because I don't have chest seals. You know, and chest seals are good. Look up what chest seals are for. Obviously, it's, you know, to seal up a puncture wound to the chest, you know, or to the abdomen, I guess, maybe. But a little bit of advice that, including myself, that I take is that go get some medical professional courses done. Even if it's just first aid, how to do CPR, how to properly dress up a wound, right? Those things are super important, and that way you have really good intentions of saving someone's life, and you don't hurt them because you don't know what you're doing, right? It's already a stressful moment. You got a person that's in a lot of pain. You know, you got people that are scared, you know, and trying to be able to perform and save that person's life can be a pretty daunting task if you don't have proper training and you're not able to, you know, think clearly in that moment. So it's always good to go get some training, and you can go to American Red Cross for that. They can help you provide courses and stuff in whatever state that you reside in, especially in Indiana. But another part of the, besides the medical kit, we're going to talk about radios in the next video. I'll give you a little insight here. This is my radio here that I have. It's a Baofeng DM32. It's a really good radio. It's analog and digital, and we'll go over more of that later in another video, and the reasons why you should have a pair of radios for you and your team, and we'll cover that in the next one. So I appreciate you guys for listening in and giving me the time, giving me your time, and I appreciate you guys, and we'll see you in the next one.